So if you guys have any questions, definitely feel free to use that raise hand tab. Put the little chat in. Danielle is going to help us out with that, and it's going to be super informal. So if you guys have any questions as we go through this PowerPoint presentation, just go ahead and ask, and we'll try to answer them as we go on. There's definitely going to be some time at the end to answer some questions too, so you can save them for the end if you'd like to do it that way as well. There's going to be a little demonstration in the middle of the PowerPoint presentation, so you guys can feel free to participate at that time. It's going to be a self-assessment, and we'll get a little bit more into that as we go on. So here we go. I'm going to share my screen now, and we'll get into the presentation here. All right. All right, here we go. So a little bit about our facility. These are some of the different professional organizations within Sacramento that we're affiliated with here. A big time shout out to the Sacramento Running Association. We've been partners with them over the last 4 or 5 years. And it's been a great relationship, just helping their elite team kind of reach their goals. We see runners from Sac State. We help out a lot with their track and field team. We're at a lot of different events. This is the SRA elite group that we've worked with over the last several years, more of a performance training class for the runners. I used to go to Fleet Feet off of J Street and do running video analysis, which you guys will see some of these throughout the presentation too. And we'll kind of talk about the importance of video analysis and what that tells us as far as injury prevention. We've been at multiple events over the last several years, the Women's Fitness Festival, obviously CIM, and we set up booths really to help runners at all the sorts. So this is kind of CIM over the last several years. This gives you an idea of kind of the presence that we have within the running community. So back when people didn't have to wear masks and gather and do all that stuff. So we do have a large history with treating the runner. We're trying to pass along some of that information to you guys. These are some of the objectives that we're going to go over today. The most common types of lower extremity injuries within the runner, risk factors for these injuries, some injury prevention techniques, which will be huge. Some of these techniques are going to be what you can do for yourself, and then some of these techniques we can show you how we can help you guys with that. The importance of screening, and there's 2 key screens that we use for each runner, and a runner-specific performance training program, kind of what that looks like, what you can do on your own, and then some different recovery techniques. But above all, there is so much information that's out there as far as if you have pain and what's the best way to train and how do I return from injury? Does leg length really affect my running or my risk for injury? How can I do all these different things? And we're going to be here as the pros to try to help you guys sort through all this information. Is a foam roller a good thing? Can I use biofreeze, compression garments? Like, there is so much out there. So we just want to be that support for you guys. So again, if you guys have questions throughout this, go ahead and raise your hand or put a question in that chat and we'll get going on that too. So what's the big deal? Why does this even matter? Well, as you all know, running is increasing recreationally, right? Ask yourself if this is the first time that you've been training for anything, or is this something that you just go out and do recreationally? It's so easy to do. You can walk outside the door. You can go for a run. You don't need any gym equipment. It's social. You can get with your friends. So running recreationally or even training for a certain event has continued to increase over the last several years. The problem is the injury for risk is huge too. So anywhere between 20 to 80% for first-time trainers going into a marathon can become injured. And so that's what we're here to help you guys out with. There's chronic injury versus acute injury. We'll talk about that. Injury leads to inactivity. If any of you guys have been injured before, you're unable to do what you love to do, which most of you guys, it's going to be running. That leads to some isolation, depression, and you can't really, if it's more of a social event for you, you go out and you run and you let go of your stress by talking with your friends. That doesn't happen as well. So again, it can become a big dark cloud for you. Millions of dollars are spent every year on doctor's visits, orthotic shoes, and I'm sure a lot of you guys have spent quite a bit of money on different doctor's visits and shoes as well. So that's why this topic is very important. And this was a study that was done back in 2000, a really good study. They took over 2,000 people who were training for a marathon, their first time marathon, and they looked at all the people who got injured, and they looked at the location of injury that they have. And as you can see, 43% of the injured people had knee issues. 18% had foot and ankle issues, lower leg issues, Achilles and calf, 6%. So this is a big chart to see where these injuries are most likely to occur. And the problem with injuries, no matter what your goals are, no one's goal is to get injured, and everyone wants to do well when they're training. But when you're injured, you slow down. Maybe you won't even finish the race, and then maybe you require your friends to kind of help you out too, and they don't do as well. So it's really important to look at these injuries, see what you can do to better decrease your injury risk and increase your performance. This is a good time to talk about soreness versus pain. I'm sure many of you over the last several years or even over the last couple of weeks have endured some type of soreness, but when does soreness turn into pain, and when does pain start to affect you with your running? There's usually 4 different types or 4 different phases of injury. One is pain after activity. So this is, you're going for a 2-mile run and then everything feels good during, but maybe later on that evening, you have a little bit of shin pain, okay? That's the first warning sign. The next phase is pain during running or during activity, but it doesn't really restrict your performance. So maybe you're going on a 6-mile run and you have pain that kind of starts in the middle of it. It continues, but it doesn't really affect your pace. You can still continue to run those 6 miles. You may or may not have pain after that activity. That's phase 2. Phase 3 is pain during activity that restricts your performance. So let's say you're scheduled to go for a 10 or 14-mile run, but you can only get through 6 miles before the pain is so bad that you have to stop running. Phase 4 is chronic unremitting pain, often at rest. So this is typically a more severe injury where you can't run and the pain is there while you're trying to go to sleep at night. At this point, it becomes very serious. And unfortunately for us as physical therapists, we typically don't see people within those first 2 phases. It's typically that 3rd phase where it is a little bit more difficult to return to running. You have pain that affects your activity, that restricts your performance, you can't hit your mileage, or you can't hit your times. If we can see people during these first 2 phases, it's much easier to continue to do your training, but also work on that injury and maybe some of the deficits you have that have led to that injury. So keep this slide in mind whenever you're feeling some soreness or pain during, after, or even at rest during your training block. Here are some most common types of pathologies, and maybe some of you guys have had this in the past. Maybe this is why you guys are tuning in, because you want to get a little bit more information on these diagnoses, but this is that same study of that little pie chart that we just took a look at. And as you can see here, the #1 injury within that that training group was patellofemoral pain. Now, patellofemoral pain is kind of a generic diagnosis for pain around your kneecap area. It could be pain on the patellar tendon, which is right below your kneecap. It could be pain around your kneecap or above your kneecap, but any type of general pain is what that patellofemoral pain syndrome is. IT band, I'm sure most of you guys have had some type of IT band soreness in the past. The IT band is a band of connective tissue that runs from the outside part of your hip all the way down to the outside part of your knee. So if you're touching the outside part of your knee, you feel that thick band right there that inserts, that's IT band. And a lot of times when you're running or training a lot, it can compress against the femur, the bone underneath, which can cause some soreness. So that's what IT band syndrome is. Plantar fasciitis. This is something that can be very, very nagging. Plantar fasciitis is on the bottom part of your foot. And again, through training and through the foot hitting the ground and some of these faults that we're going to talk about a little bit later, you can develop little partial tears in that plantar fasciitis, causes inflammation and pain. Shin splints, this is a huge one. Shin splints, if left untreated, could lead to some type of bone injury like a stress fracture. Shin splints are typically on the inside part of your shin, not the soft tissue around it. So you have your calf muscle that's kind of deep there. If you have pain over the bone, that's typically where that shin splint area is going to be. Patellar tendinopathy, so the patellar tendon is right below the patella that kneecap area. So this is typically called runner's knee. And again, it's when miles start to go up and up and up and you're not recovering well. You're not doing your stretching and kind of the strength exercise that can keep you out of that overuse syndrome. Achilles tendinopathy, kind of the same as patellar tendinopathy. It's any type of issue with that Achilles tendon, which is down by the heel on the backside of your lower leg. So all these things, as we go through this presentation, obviously if you have a question, go ahead and raise your hand. We're going to get into some of the risk factors for these injuries and what you guys really need to look out for, and then some of the easy ways you guys can do some self-care as well. So I'm gonna let Leslie take it over from here, and she's going to talk about risk factors and some of the strengthening exercises.
So the biggest things that we look for and what has been shown to predict future injury is, number one, if you've had a previous injury, you're automatically at more risk of a second or future injury, which makes it that much more important to properly recover, not just to get you through your upcoming race or through that next run next weekend, but to keep you running for as long as you want to. The next thing we look for is poor single leg stance control, which is what you're seeing in this little video right here. Her knee is going in towards the inside of her foot rather than straight over the toes, and her knee and hip angle is all wonky. So we look for things like that. Novice runners are automatically at more risk of an injury just because they have no experience. So you build safety into your running just by running more miles over the years. So your safety at 5 years into your training is much higher than your safety in your first year of training. So things to keep in mind, and really think about how quickly you're increasing your mileage or your intensity. So think about increasing your mileage before you start working on speed work, things like that. That's why it's so important to have a base building phase in your training program. And they found that men who train more than 50 miles a week have more injury risk compared to those who train less, and likewise with women who train more than 30 miles a week. But these are all things that you don't have to be afraid of as long as you're doing the things proper for recovery and to support your body while you're running, which is some of the strengthening that we'll get into. Training for an event, obviously, if you're training for something versus just running recreationally, that automatically puts you at a greater risk. Some of those things include just the pressure of training for an event, whereas maybe you would skip that run next weekend or shorten it because you're just not quite feeling right, but it's the miles on your training program, so that's what you feel pressured to do. So things to keep in mind just mentally too when we talk about training programs. Men who are younger than 34 years old are at a higher risk of knee injuries, and women with a body mass index of less than 21 are also more at risk. So sometimes that can get into things like just proper form for these young guys who just go out and run, and for women who maybe could benefit from some strengthening to help with body mass.
Leslie, we have a couple questions.
Okay.
So Brittany had a question. She said, I have foot and knee pain after long runs, so 10 or plus miles, and later that day and the next day. Is that an injury that she should seek physical therapy for? Or is that something that's kind of normal?
Yeah.
So yeah, that's a great question, and that's not uncommon. What we typically say, and if we're talking about that slide with those 4 phases of injury, she seems like she's at the phase 1 of that. So no pain during running, but has some pain afterwards. If that pain is lasting more than 24 hours, that's definitely something that you want to have taken a look at. And also, if it's something that's been lasting probably more than 2 weeks, that's also something that would prompt you to get it looked at. It doesn't have to be a physical therapist. It can be your primary care physician. It can be a chiropractor. It can be a sports medicine professional that you've had experience with before or that you trust. So anything that's lasting longer than 2 weeks, anything that's worsening, and definitely pain that kind of is hanging around after your run and lasts more than 24 hours, all those are kind of signs that it might be something that you need to get looked at.
And then there was another question about the background noise, but I know you guys are in a training facility, so I don't know if there's much we can do with some other people training.
We can move into a quieter room. We do have an active training group going on right now, but we can definitely move into a quieter room until we do the demonstration component.
Okay, that's all the questions so far.
Okay, cool. So let's move here. Just give us like 1 second. Yeah, those are definitely good questions though. All right, so is that better with the background noise?
Yeah, that sounds good. Thanks.
Cool.
So the next things we look at are prevention. So we looked at all the risk factors, or at least some of them, and now we look at prevention techniques. First and foremost, be smart, think it through. Don't let your emotions get the best of you when it comes to, you set out the door thinking you're gonna do a 3-mile run at X pace and you're not feeling quite right. Slow it down or shorten your run, whatever you need to do. A proper warm-up is vital. Even just checking in on a dynamic type of warm-up that you know you're always tight in your quads. Well, stretch them a little bit before, but dynamically. And we'll talk about that a little bit. And then a specific strengthening and stretching routine that you know works for you. So that takes trial and error. But I know if I don't do single leg bridges twice a week, my runs are not going to be as fun. And then we'll talk about some screening and runner recovery options that we offer here, as well as ones that you can seek elsewhere. So slow and steady with your training and increasing your mileage, working on the base building that we talked about before increasing your speeds, hydration, and really paying attention to before you run and after your run, not just during your run. If you're on a run and you're thirsty, you've probably already become a little dehydrated, and that can have big impacts on your performance. And that will lead to that. And then also, obviously, wearing the right footwear. Fleet Feet is great for this. They have so many cool tools and great staff that will fit you for the correct shoe for your foot. Keep in mind that there's not a specific brand likely that is just right for you. There might be several brands. It's the type of shoe, and each brand will have a slightly different category and fit for that. Here's our dynamic warm-up. This is what we recommend before all activities. But especially running, and very important to have a dynamic warm-up. This one especially includes some lateral movement as well. And I believe all of these handouts will be available to you guys. Foam rolling is also good. Some people like to do it right before their run. Some people prefer afterwards, or a little bit of both. Big things to focus on are the quads, the glutes, and the calves. But again, with everything, you'll figure out what works best for your body. And then after runs, not before, after your runs, a static stretching routine where you address the major muscle groups that you've been using for your entire run. And you'll also get a good feel for this after your runs, where maybe your calves are always tight and you spend a little extra time on that, but your quad stretch, you can breeze right through. Lucky you. And then as far as performance goes, similar to what we talked about, the dynamic warm-up, proper flexibility and recovery to make sure that you're ready to go. So you're not just dealing about the after effects, but we want to worry about before, during, and after. And if you're looking at a longer distance race, you got to have the muscular endurance to do that. So what are you doing outside of running to help your endurance other than just running more miles? And then if you're looking at a shorter race, then we think about power, what creates power, and that might be different exercises or volumes of exercises. Strength training, this is big. And this is luckily becoming a lot more discussed in the running community in the last 5-ish years. But reversing the effects of running, which sounds so silly, but we think about this, it is a dynamic thing, especially if we're trail running, but we're doing this pounding activity and hopefully we have good form, but most of us don't have perfect form. So we need to do things to offset what we're doing and what we're requiring of our body. So we recommend 2 to 3 days a week, 3 sets of 15 to 20 reps. And the reason for that high rep load is because think about running, it's constant high reps. And the biggest thing we look at, and Dan will talk about this more when we talk about our screenings, is symmetry, AKA balance. So if my left quad is much tighter or weaker than my right quad, it's going to have an effect on how my gait is during my run cycle. And then there are specific things that we strengthen and focus on for running. So these are some of our basic strength exercises that are easy to do in your home. You don't really need any equipment, but a band is great. And again, you guys will have access to all of these handouts. Things we can do with the ball to incorporate core as well.
One quick question that I see on here: would a slow mile jog be sufficient enough for a warm up as an alternative to the dynamic warm up? Or I'm assuming
It's not ideal because running is still running. So we look for more of bringing in some lateral movement and rotation. So that's why you'll see some of the things like the lateral lunge and the turn and reach, and the cradle gives us some lateral movement as well, because even though running is moving us in a forward motion, we're still asking a lot of our stabilizers, which are often lateral.
Yeah, and one other thing with running for warm-up, which isn't a terrible idea, and I know that a lot of people will go for, you know, a 10 to 1 mile run to warm up and get the body warm. And you're definitely going to feel a lot better if you do that before you get into your training pace. But one thing with the dynamic warm-up, it does stimulate your muscles in order to respond a lot faster. So there is a neuromuscular dynamic to the warm-up as well. Another thing is, you know, a lot of us kind of with our job, and especially now with COVID and everyone's sitting more so than normal, people who have had active jobs before, maybe working from home. So certain muscles get really tight. And it's very difficult for you just to get up after sitting for 4, 6, 8 hours and then go out for a run, or even waking up after sleeping for 8 hours and have your body be really prepped the right way for your run. So the dynamic warm-up is a great little check to check every single muscle group. It gets the neuromuscular system going really quick. It gives you a quick flexibility check. And then you can spend a little bit more time on the muscles that are tight before you run. That tightness can affect your running form, and we're going to talk about that a little bit when we get into some of these other screening techniques. Does that answer everything there, Danielle?
Yep, sounds good.
Cool. All right, so when we look at screening, there's 2 different screens that we use. The first screen for our runners is the functional movement screen. The functional movement screen is a series of 7 different movements, and each movement gets scored for a total score out of 21 possible points. Now, these points are important because a lot of the research suggests that if you score below a 14 out of 21, you're at an increased risk for injury. So it's a great injury risk assessment tool. Doing these 7 different movements also gives us great insight into areas that you're tight and weak, which if we correctly prescribe those exercises, then you're going to be a more proficient runner as well. The other screening tool that we use is the running biomechanical analysis. This is where we get you on the treadmill, put markers on your body, video you from the side and the back. It's slow motion, so we can really see different deviations at a really slow speed that otherwise may be pretty difficult to look at with just the naked eye. So from here, we can take a look at some of the common deviations that lead to injuries over time. Putting that in combination with the functional movement screen really gives us an overall great screening tool for all runners. So the functional movement screen, and we're going to do components of this during our demonstration. You guys can participate with that as well. It's really to identify asymmetry from side to side, mobility and stability issues. Mobility is going to be more flexibility or range of motion issues, and stability is going to be more weakness issues. Like I said on the previous slide, if you score below a 14 out of 21, you're going to be at a significant risk for injury within the next year. There was a really cool study that they did with healthy distance runners and found that normal for distance runners is a 13 out of 21, even though that increased risk is below 14. The DS is a deep squat, and the ASLR is an active straight leg raise. So again, these 2 movements are scored out of 3. What they found with the study with track and field athletes, if you scored below a 3 out of 6 for these 2 movements combined, they were also at an increased risk for injury. What was really cool with this same study is they saw that people who scored above a 15 out of 21 had a significant increase in their performance within that next year. And then they also saw that with the deep squat, if you scored a 1 out of 3, these people actually had a significant worsening of their performance. So this is a great injury risk tool, but it's also a good performance tool too. So when we get into the participation component in a couple slides here, and we're going to ask you guys to kind of do these 2 different movements and see where you're at, and then we can prescribe some of these corrective exercises that can help you. So this is a little video that's going to explain the functional movement screen a little bit more.
With the functional movement screen, we take you through 7 different movements: an overhead squat, a hurdle step, a lunge, a hamstring flexibility test.
That's going to be the one that we do.
A shoulder mobility test, linear stability test, and a rotary stability test. The runner gets objectively scored 0 out of 3 on each movement to come up with a composite score of 21. You score a 14 or below out of 21, then you're at an increased risk for injury. So it's a really great tool for us to determine injury risk. And also it gives us an opportunity to determine areas of weakness or tightness in the body and asymmetries from side to side.
That was a much younger Dan MacLean right there. So don't judge me, okay? Don't judge me. All right, so this is how we're gonna move into the next component here. We're gonna do a self-assessment with everybody. So whoever wants to participate, what we're gonna do is we're gonna go over the overhead squat test, and then we're also gonna go over that active straight leg raise test. So Leslie's gonna be our model here, and then depending on how you guys look and feel, we're gonna break that movement down to see if there's any mobility or stability issues within that squat and that hamstring test as well. So let me get out of our sharing the screen here and get back to the live camera. How does that go? New share. Oops.
Maybe click on Zoom again, the Zoom thing down.
Click on the Zoom. Still nothing?
Mm-mm.
This didn't happen when we practiced earlier, guys. What's going on? What is going on? Stop share. Got it. Perfect. Okay. So we're going to come back out to the open space. So sorry if it gets a little bit noisier again. So if you guys do want to participate here, what you're going to need is just a little bit of space to do a squat test, and then also lie down on the ground to do the hamstring mobility test. Okay. So Leslie's going to grab this stick here, and we're going to do this overhead squat test. Good. So if you have a stick or you have something to hold overhead, that's great. If you don't, just go ahead and put your hands overhead. So what you're going to do is stand with your feet about shoulder width apart. Hold the hands up overhead, and you're going to squat down as deep as you can go. Good. That bottom position is really what we're looking for. We want to see the knees in line with the toes. They don't cave in, and that stick stays overhead. So Leslie's going to come back up, turn to the side, and you guys can do this too. She's going to squat down again. We want to see the hips get to about knee level from the side. That stick staying overhead with her, that's pretty good, but it's pretty difficult for her to get her hips below the knees there. So if that feels difficult for you guys, what we can do is break this movement down a little bit further to see, why does that squat feel so stiff? Why can I not obtain that full range of motion? So we can take a look at the ankles first, and this is a great test that you can do for yourself too. So Leslie's going to get in the side view there. Good. Get down on one knee. So you guys can get down on the ground. Without the shoes is more ideal, but Leslie has her shoes on for this demo purposes. What you want to try to do is drive your knee past your toes there without the heel popping off the ground. What you can do is get a stick or just use your hand and see how far your knee can get past your toes. Put your hand down on the ground and see if your hand can go sideways like that in between your toe and the stick. If you can do that, then you have pretty good ankle mobility, and we can check that off the list. If that's difficult for you to do, or you can't do that, well, that's where you're going to do a lot of the calf stretching and a lot of the soleus stretching that we showed in the previous slide, and we can go back to that. So that'll take care of the ankle mobility component. If you feel like you feel something more in your hips when you do the squat, then this can be a hip assessment here. You're going to lie on your back again. And then what Leslie's going to do is she's going to try to bring her knee up towards her chest. Now you want to try to bring your knee up towards your chest without your lower back rounding a ton. If if your lower back rounds a ton, that means you're getting that movement from your spine and not your hip. So if you can get your knee halfway from your hip to your chest with good movement, not really feeling anything in the front of the hip, you're doing pretty good mobility-wise. If this is a struggle for you, or you start to feel a little pinch in the front of the hip, well, that tells you that you need to focus a little bit more on your hip mobility. So 2 of the stretches that we do for that are a pigeon stretch, which gets the back part of your joint. So Leslie can show us here. So that's a pigeon stretch, and that's on the previous slide with our static stretches. That'll help open up your hip a little bit. And another one is just a gentle hip flexor stretch. So you can get in the kneeling position, and you want to try to drive your hip towards that front foot there to feel that stretch in the front of the hip. These 2 stretches really help open up your hip, make that deep squat motion a lot smoother for you, okay? Sometimes, stand back up. If both of those mobility tests are clear, you can take a look at your knee. So Leslie takes a little step forward, and then she's gonna do the squat pattern again. It goes down like that. Now, if any of you guys have mini bands, what you can do is put the mini band around your knees as you do the squat. I'm gonna put my hands down here like this, and she's gonna push out to my hands, hard, 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 hard. Good, and back up. Now she's gonna turn and face me, so you guys can see from the side. She's gonna squat down again, hard, 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 hard. Good, she can get a little bit lower with that. Okay, back up. So you see how her hips got a little bit lower than her knee there. So instead of doing a lot of stretching with Leslie, she's gonna need to do a little bit more of the hip strength exercises, again, that we saw in the previous few slides. So this is a great way that we can, 1, assess your movement, and then give you some corrective exercises to address that, which are gonna make you a better runner and decrease your injury risk. Now the next movement is gonna be that leg raise test. So she's gonna lie on her back here. This is something you guys can do here too. So again, that deep squat and leg raise test were the 2 most predictive of injury in that running study that we took a look at on the last slide. You want to find the midpoint of your thigh. So somewhere in the front of the hip, that little ball in the front of the hip, and then down by your kneecap. You go somewhere in between there. You put a stick right there, and then she's gonna try to raise her leg as high as she can. If she can pass that stick, she's looking pretty good. If that foot doesn't pass the stick, well, then maybe you have some hamstring or hip flexor issues. That's when you spend a little bit more time stretching the hamstring. That's when you spend a little bit more time stretching your hip flexor, like we saw previously. Another thing she can do too is really tighten her abdominal wall. So almost like if you're doing a plank or a sit-up, she can do a little crunch here as she raises the leg. If that makes your leg go a lot higher, then you know it's not tightness that's decreasing that leg raise. It's going to be more of a core stability issue. And that's where you can do some planks, little crunches, dead bugs, those type of exercises to really focus on your core stability. So did anyone find any deficits that they had there as they did any of those movements or a couple of those screening tests? If you had any specific deficit there, like you couldn't get your knee over your toe or you couldn't raise your leg really high when you're lying on your back, again, those can be some mobility issues that can affect your running there.
Looks like we got a couple people with hip flexor, the hamstrings.
Yeah, so is that the one where they were lying on their back and kind of raising the leg straight up?
I don't know. They just said hip mobility. Oh, yes. Yeah.
Hip flexor, yeah. Knee to chest right there, yeah. So with the knee to chest, that's going to be where you're going to want to do that pigeon stretch and then also stretch the hip flexor and then retest that knee to chest. That's very common. That's a very common mobility deficit for runners. And then, yes, I saw the hip flexor one, hip mobility, hamstring and hip flexor. Yeah, so those are very common as well. Some of the ankle mobility we'll get into with the second screen, the running biomechanical analysis here. I'm going to share the screen again. And again, if we have specific questions, we can go over those at the end as well. So this is going to be another little video here. You guys can tune in and listen to this. This is the running biomechanical analysis, just
The
explaining.
running biomechanical analysis begins with the runner coming in the door, and then we have specific markers that we place on the runner's body, which helps us determine joint angles that we go over with the runner during the analysis portion.
Okay, so I put these videos up so you guys can get a little bit of visual of the screening that we're talking about. When we go through the running video analysis on the treadmill, there's a couple key things that we're really focusing on. If you have anterior knee pain, pain in the front of the knee, these are some of the common deficits that we see. Overstriding is huge, and overstriding, as you can see in this picture on the left with the A and B screen, that B screen, that heel is way in front of the hip marker there. That's what we would call a significant overstride. When you look at the A picture, that heel drops like right underneath the hip. That means you're absorbing the load really well. The problem when you start to stride out too far is that changes our force curve, which when we strike underneath our body, you can take a look at the curve on the right. It's a nice symmetrical bell curve. When we start to overstride out in front of our body, you can see the arrow on the left curve. There's a little spike in force right there. So you can imagine that spike in force as the heel contacts the ground, then it goes down a little bit. Your foot is now underneath your hip, and then you get a bell curve off of that. That's not a problem if you only, go out there and run 4 to 5 steps and then you're done. But when you start getting to the 10, 14, 15 mile volume and you stack days on top of days, weeks on top of weeks, that little spike in force is like a hammer that is just hitting the bottom part of your heel. And over time, that's going to cause increased stress to your whole system. So when you strike out in front of your body, you have a little spike in that bell curve. When you strike underneath your body, it's a more symmetrical bell curve. Nice and smooth buildup of force and release of force, which again, over time is going to be a lot more beneficial for your body. Also, a stiff landing is another deficit that we look at. So when the knee doesn't bend much, and this knee angle of 20 degrees is much lower than the 30 to 40 that we're looking at, you're not absorbing load through your knee and the muscles, it's just going through your joints. Anterior knee pain can also look like this with our running analysis. So on the picture on the left side, that's a pretty significant hip drop. The hip falls out to the side, causes rotation down in the knee, and vertical displacement. This is more jumping up and down versus propelling yourself horizontally like you should when you're running. Achilles tendinopathy, so that Achilles pain looks like this with our running analysis. The picture on the left is excessive dorsiflexion or ankle motion. It just stretches the ankle out. And over time, that can cause increased pressure through the Achilles. The picture on the right is a lack of hip extension. So if you can't extend your thigh behind your body because of tightness in the front of your hip, what's going to happen is you're going to overutilize your Achilles and your calf. So you'd be more of a calf dominant runner, and that can cause to overuse. IT band and tibial stress fractures. Tibial stress fractures can happen on the inside part of the shin like we talked about before, and IT band issues really spark up if that leg is crossing midline. So if you look at the picture to the left, her foot is crossing that yellow line, which is her midline. That can cause increased friction on the outside part of the knee. And then also over to the right, a syndrome called too many toes, or you see that foot kind of caving in as well. That can cause a lot of those tibial stress injuries that we see on the inside part of the shin. So injury management, if you guys are starting to ramp up your training and you guys are feeling some soreness, kind of like the lady that we talked about who's having pain after her runs, it is a good idea to just go get it checked out. The benefit to this is if you go early enough, a lot of the times you don't have to stop running, right? You can still manage those symptoms. You can still do your volume. Maybe you have to decrease your volume a little bit or only run 3 days a week versus 4 or 5. But if you catch it early on, it doesn't necessarily mean you have to stop your training. You guys see the circles on Phelps here, and this was pretty big in the Olympics last time, where cupping has become a lot more commonplace. It's always been around the Eastern culture, but the Western culture, we're starting to use a little bit more orthopedically. You can see that little divot inside of the cup there. That's scar tissue. And whenever you're doing repetitive motion over and over again, undoubtedly scar tissue is going to rise up. Cupping is a great way to kind of break that scar tissue, increase blood flow, and regain your flexibility that you might be losing with just the increased volume of running. Graston technique, these are little metal tools that we use to kind of go up and down the tissue and find those tight areas. So this is another modality that's often used in the sports medicine field. This can, again, also increase your flexibility, regain your range of motion after running high volume weeks or months. The AlterG treadmill, if you guys haven't seen this, go ahead and Google the AlterG treadmill and you guys can see some YouTube videos. It's an anti-gravity treadmill. So if you guys are to the point where maybe we're at that phase 4 where you're unable to run on land because it's so painful, you can come in and use the anti-gravity treadmill, continue your training while your injury is recovering, again, not having to stop your training midway through your training block. Normatec compression, this is not how you use them, so please don't anybody try this at home, but Normatec compression is a really good tool to increase circulation in your body. Whenever you run, you have that dead leg syndrome. These Normatec boots start at your feet and pump blood back up into your trunk. So it decreases all that inflammation that's normal with training. And then a Theragun. A Theragun is an excellent tool. I'm sure a lot of you guys have it. It's become very popular over the last couple of years. This massage gun has been hypothesized to do a lot of different things like increase your muscle tone, increase flexibility, all that stuff. None of that is really proven. The only thing that Theragun is proven for is decreasing your muscle soreness, which is beneficial and very helpful. So if you guys are going for a run, using your Theragun on a sore quad before you run is going to make it much less sore after your run. Same thing, if you feel some hamstring soreness after your run, you use a Theragun, it can help decrease that muscle soreness with that vibration therapy. But anything that's hypothesized more than that has not really been proven yet. Another thing that's not listed on here are hot and cold showers. So contrast baths have been used a lot for like injury, but just to flush your system, if you turn on the hot water for 3 minutes, turn the cold water on your shower for a minute, it kind of shocks your system and sends blood from your extremities into your trunk. You turn that hot water back on, you get new blood down into your extremities. So that really helps with recovery as well. This is our runner's recovery package, and this has been tremendous. You guys can see this is a Theragun over on the left. This is a runner who's coming in. She runs very competitively, 50, 60 miles a week. She comes in, we do the Theragun. She does the Normatec compression boots, which you can see over on the right to help flush out the legs. And then we follow that up with spot treatment. So she's been dealing with a knee injury. We can put the Game Ready sleeve on her, which is an ice compressive unit to help out with some of that soreness. But a lot of people say they feel much lighter. They feel like they can train again the next day when they have that heavy leg syndrome. So in summary, and I know that we have some questions here, repetitive running can lead to injury. Let's be proactive about it. Let's do something so that you guys don't become injured in the first place and you're unable to run. That's some of the stretching, foam rolling, strength and exercise that we showed there. Getting screens, always a great idea. And if you're having something it's a little sore, just get it checked out. There's no harm in that. It may be nothing, but it may be something big as well. Develop a good strength and stretching regime, which I hope we've done here today. I think you guys will be able to see this PowerPoint presentation in the future on the YouTube channel. So you can always go back and take a look at that or screenshot it if you need to. Screen for the injuries before they happen. The functional movement screen and the biomechanical analysis are great tools to use prior to beginning a training program. Address the minor injuries before they become major, and I can't stress this enough. A lot of the small things can be dealt with really fast if we catch it in time. If it comes to the point where it's a really bad tendon injury or it comes to a point where it's a bone issue, well, then you're going to have to stop running. So address these things when they're minor. Don't wait till you're feeling it at the end of your run or you can't sleep because you have pain. If you do all these things, you're going to be able to run faster, stronger, longer than ever. You're going to feel a lot better doing it. You're going to feel recovered in between your training sessions. these are the different services that we offer. If you guys have any questions about this stuff, you can go to www.resultstherapy.com. Again, resultstherapy.com. It's very simple. It has our number and our different locations on there. Other than that, that's kind of it. We're going to open it up for questions now. These are two strong kiddos. They're not runners yet, but probably one day they will be. This is my direct email. This is Leslie's direct email. So you guys, again, can take this information down. If you guys have specific questions that you don't want to ask tonight, we can also answer those through email or even on the phone with you. Danielle, we got any questions?
Yeah, I guess we can start with some of these ones in the chat, and then I think maybe people can do the raise the hand too and ask them themselves.
Cool.
So I'll just start at the bottom. It says, is it true it's more beneficial to stretch the second you get out of bed? Also, is there such a thing as overstretching in general?
Yeah, so stretching first thing out of bed, it kind of depends. That's going to be what do you plan on doing that day? I mean, if you plan on going for a run, the best thing would be to get up, kind of move around for 10 to 15 minutes and just get your body loose that way. That dynamic warm-up is going to be very important right before, especially an early morning run, just to get your body a little bit more prepped. And if you have any specific tightnesses, that'll be the time. Like, let's say your hip flexor is tight and we've identified that on some of these screenings, then that's something that you'll want to kind of focus on before you run so it doesn't change your gait pattern while you're running. Stretching too much or too aggressively, that's 100% true. I mean, a lot of people try to go into a stretch and they go 100 miles per hour into it, and then they actually end up straining something. So when you're stretching, you want to get to that point where it's uncomfortable, but you definitely don't want to be shaking and you don't want to be fighting the stretch. Stretching is much more about relaxing, gaining flexibility that way, versus actually changing the tissue fibers and trying to lengthen that. So if you're stretching too aggressively, that can definitely be counterproductive.
And then actually another question just with stretching, how long should you hold a stretch?
Yeah, so what we like to tell people, and some people get a little bit upset with this, but it's kind of true. Whatever decade of life you're in, you're going to stretch for that long. So if you're in your 30s, you're going to stretch for 30 seconds. If you're in your 40s, stretch for 40 seconds. If you're in your 20s, stretching for 20 seconds. In your 60s, 60 seconds. Holding a stretch longer than 60 seconds really doesn't have any added benefit. So holding for 60 seconds and holding for 5 minutes, you're not getting any increased benefit and flexibility there. So I guess that's a more specific answer. A more general answer would be anywhere between 20 to 60 seconds. Sometimes it takes people a little bit longer to relax into the stretch, and that's completely fine. Start your stretch timer when you've relaxed into that position.
And then Nancy had a question. What are your thoughts on cryotherapy?
Cryotherapy is great. I mean, any type of cold compression you can get on an area that's not feeling very good is going to decrease soreness. Soreness is going to happen with training. It's inevitable. But if you can manage that stuff, then you're going to be doing okay. Ice therapy or cryotherapy helps with soreness. It helps a little bit with inflammation as well. So that's really going to be beneficial in any time that you're training and any time that you're feeling some joint soreness.
Okay. And then Vince had a question, I guess. He says, while he was playing volleyball, he jumped and landed and he turned his ankle. But the ankle got better, but now his left hip is affected. And he can't really describe the ache in the hip. Are there any exercises or stretches that can help the hip?
Yeah, there's a ton. It's a little bit tough to kind of diagnose and prescribe specific type of stretches in the hip without seeing how you move and seeing the different movements that may be affected. But I would say in general, doing a good quad stretch, doing that pigeon stretch that Leslie showed us as well, will probably be the two biggest ones, as well as that hip flexor stretch. So hip flexor, quad stretch, pigeon stretch. If we're talking about general hip tightness or soreness, if you hit those three, you're going to kind of be getting every single angle of the hip. So those would be some good ones to try to see if that helps relieve some of that hip issue.
Okay. Another one, Josh had a question also about an injury. He said, I was experiencing pain on the outside of my foot after a long run, and it went away after a couple of days. So I was just wondering if you know what that would be.
Say that one again. Sorry.
So he had some pain on the outside of his foot after a long run. I think that it got better, but I mean, maybe that's something he should come see a physical therapist for, or.
Yeah, and remember, and we can always reference that slide that have the different phases of injury, right? So the first phase, do you have pain after running? Do you have pain during running but doesn't affect your performance? Pain during your running that affects your performance? And number 4 is I can't run because it's so painful. So like we talked about, this first one, if you try some of these self-help techniques like the foam rolling, the stretching, strengthening, a lot of times it can clear that up. Once you start getting into pain that is present during running, but it doesn't affect your performance, that's when you should probably get it checked out. The pain in the outside part of the foot, it can be a lot of different things. It can be the peroneal tendon that attaches to the outside part of the foot. It can be some of the ligaments on the outside part of the foot, or it can be some type of bone issue as well. So if you're kind of poking around and you feel a lot of tenderness and sharp tenderness over the bone, that's a big warning sign. So that's something that you definitely want to get it checked out.
Okay. And then Katie had a question about compression sleeves. So she says, is it a good idea to wear compression sleeves while running for tight calves?
Yeah, and I was waiting for this. This is probably the number 1 question that we get regarding garments and stuff, are compression sleeves around the lower leg. If you have tight calves, there's usually 2 reasons you have tight calves. 1, because the muscle is tight and stretching it is going to be much more beneficial than wearing a compression sleeve. Or 2, you've been training a lot and you're starting to have increased fluid down in the lower leg and the calf. That's where a compression sleeve can help. It's really dependent on the person. If you're wearing the compression sleeve and you feel like it's making you kind of slower and you're dragging more, that compression garment is probably decreasing blood flow down into your lower leg. In that situation, you wouldn't want to wear it. If you're wearing the compression garment and you feel like it actually makes you feel lighter and looser, well, maybe it's helping get some of that fluid out. So I guess it's really dependent on how you feel while you're using the garment.
And then another one, I think from Josh, he says, I have a friend who stretches in the middle of her runs. Is that helpful?
That can be very helpful. So let's say you're going for a 4-mile run. At the 2-mile mark, you're like, man, my calf is just really tight. Okay, I'm going to stretch that out, and then you can kind of finish your run. Or, man, I have like on the outside part of my hip, it just starts to get really tight at a certain mile distance. At that point, yeah, you can start to stretch. If it's something where you have to do that constantly, again, that's an issue where you might want to take a look at that a little bit more. But if it's something where they go for a mile or 2 and then they feel like that's where they can get a good stretch, their body is warm and they just get more beneficial stretch, and that can be good.
Okay, and then we had a question from Raj about BMI. And specifically women's BMI, and she was wondering if you could explain that a little bit.
Yeah, no, that's good, because that was on our risk assessment or injury risk slide there. So the BMI, if you're below 21 and you're female, in the research, that's where you're at an increased risk for a tibial stress syndrome or a tibial bone injury. So that shin splints can turn into just a soft tissue issue on the inside part of the shin, and it can turn into more of a bone issue later. So one hypothesis with that is if you have a very low BMI, sometimes you're training a lot, your body's not receiving all the calories it needs to keep the bones nice and dense. So without getting into too much of the physiological issues that occur with that, if you're not taking in enough calories, typically those are people who have a lower BMI. The bone starts to weaken as your body tries to extract calories from your bone. So that's where that injury risk kind of comes in if you're at a lower BMI. That is something that, again, you'd probably want to go see your doctor. And if you have any concerns about that, they can point you to a nutritionist, or they can take a bone scan and make sure you're your bone density is up to where it needs to be.
Great. And then Lisa had a lot of nice things to say. She said she's used AlterG at Results, and she's wondering, do you recommend using the AlterG once a month to give the joints a break from road running?
Well, thanks for the nice stuff, Lisa. And I appreciate you being with us and using AlterG in the past. This is something that I've even talked to Danielle with and the other SRA elites. It's always a good idea, especially if you're feeling a little fatigued, and maybe you're going to have a active recovery day where you're going to go swim or you're going to bike. The AlterG is a really good option in lieu of those other options, because you can decrease your body weight down to like 60 or 70% body weight. So it can be kind of like more of a therapeutic way of an active recovery. You're still going through your running cycle, so that's not changing like it would change on the bike or swimming, but you're not putting the large impact and load on your body that you normally would if you're running out on the road or even trail. So I would recommend, if you're going through a 16-week or 14-week training block, that maybe in the middle to the end of it, yeah, you use it more so for an active recovery day, maybe even once a week, not even once a month. And that way you can continue to keep your miles up, but you're not having all that load down on your body.
Okay, I don't see any more in the chat. So if anyone wants to raise their hand and ask a question, or if anyone has anything else, now's the time.
I see that Raj put, so I need to eat more. So I think that's in reference to the BMI thing. That's something that is just in the studies, what they've seen as an injury risk for the tibial stress injuries. So everybody is so different. Just because you're in a lower BMI doesn't mean you're going to get injured. It's just one of those risk factors there. And they can't really, identify people who have a higher bone density, a lower bone density. It's just kind of a general rule of thumb there as far as that BMI.
All right. We'd like to thank Dan and Leslie for the great information they provided. We're coming up on 8 o'clock here. And again, this is going to be posted on our YouTube account. So check the Sacramento Running Association website for a link to that. And you can get all this information there. If there's other questions that pop up, like I said, you can post it in the comments there. But again, thank you guys for joining us, and a big thank you to Dan and Leslie and Danielle for facilitating that as well. I wish this was a forum where we could provide the applause and everything, but just know that a lot of people are real appreciative of the information, a lot of great comments that have come through. So thank you guys so much. Good luck to the rest of you guys in your training. Our next installment of the CIM University is going to be in October, and it's going to be dealing with nutrition and hydration and fueling with regards to running. We've got a great thing planned there, tentatively scheduled right now for October 20th. We'll provide more information, so keep an eye out for that. And again, thank you guys to everybody, and we'll see you guys soon. Thanks again.
Thanks for having us.
Thank you, guys.